Welcome to the CJSIM podcast. We are Shengyuan Luo,
Morgan Grams,
and Joseph Koresh from Johns Hopkins University. Today, we're going to talk about our study, Serum Metabolomic Alterations Associated with Proteinuria in Chronic Kidney Disease. This study is an important part of the Chronic Kidney Disease Biomarker Consortium's recent effort to integrate transomic data to improve GFR estimation and CKD risk prediction.
To date, data are scarce on the blood metabolite associations with proteinuria, which is one of the strongest markers of adverse chronic kidney disease outcomes. In this study, we used stored serum samples from the African American Study of Kidney Disease and Hypertension and the Modification of Diet in Renal Disease Study to evaluate associations between 24-hour proteinuria and 637 known non-drug metabolites. Using linear regression, we discovered 66 metabolites with cross-sectional associations with proteinuria in one or both studies, of which 58 were statistically significant in a subsequent meta-analysis. Of these, 4-hydroxychlorothalonil and 1,5-anhydroglucidol had the strongest and most consistent associations with proteinuria, both with p-values lower than 10 to the minus 27th. 4-hydroxychlorothalonil is the primary metabolite of a pesticide. Quite surprisingly, it was detectable in more than 80% of our samples, and it turned out to be inversely associated with proteinuria, meaning that a higher level of the compound was seen with lower levels of protein in the urine. We hypothesized 4-hydroxychlorothalonil to be a marker of healthier lifestyles, such as vegetable intake or outdoor activity, or it might be related to altered tubular function or metabolism in the context of proteinuria. In a longitudinal data analysis, 4 of the 58 metabolites, namely 4-acetamidobutanoate, N6-carbamoyl-threonyl adenosine, N2-N5-diacetyl-ornithine, and kynurenate, were associated with end-stage kidney disease in both studies. Among the metabolites associated with proteinuria, we also identified phosphatidylethanolaamines, which are an abundant class of phospholipids in humans with diverse cellular functions, to be an overrepresented metabolic pathway.
In summary, untargeted metabolomic profiling demonstrated 58 serum metabolites that were associated with proteinuria in CKD, 4 of which also associated with end-stage kidney disease. We view our study, along with other metabolomic studies, as an important starting point to better understand kidney disease pathophysiology and aid in the discovery of novel therapeutic targets.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.